Hi, I'm Jenna Hatcher and I'm the Outer East Alliance Facilitator. I'd like to welcome you to this recorded video around the Eastern Navigation Resource, specifically looking at the Integrated Family Services Program. I would like to acknowledge the traditional custodians of the lands, the Wurundjeri people of the Kulin Nation, on which we work on in the Eastern region. We recognise their continued connection to the land, the water and the community, and all other lands you may be on today. I would like to pay our respects to both the Aboriginal and Torres Strait Islanders and their respective cultures. I would like to pay our respects to all elders who have passed and those that may be present here today. The land we are all meeting on has never been ceded. It always was and always will be Aboriginal land. As I mentioned before, I'm the Alliance Facilitator, and my role is to facilitate the partnerships within the Family Services Alliance. We do this by ensuring there is an ongoing and shared strategic planning with a specific focus on regional issues. There's a continuity of service with a strong focus on demand management and resource allocation. We provide a consistency of service to clients with shared processes, policies and guidelines across the Alliance. We look at continued implementation and review of policies and procedures. There is established and smooth operational administration within the Alliance. We're supporting the workforce capability building, the ongoing and creative opportunities for cross-sector partnerships, and there is a strong focus on self-determination for all Aboriginal and Torres Strait Islander families. So who's the Alliance? Family Services is provided by numerous agencies. So as you can see below, there's quite a few. In the Outer East, we've got Anglicare Victoria, Uniting VicTAS, Eastern Access Community Health, otherwise known as EACH, Victorian Aboriginal Childcare Agency, commonly known as VACA, Bundawan Willem Aboriginal Healing Service. This is usually abbreviated to Bundawan or BWAS, and MacKillop Family Services. And in the Inner East, we have Anglicare Victoria, Uniting VicTAS, DonCare, CamCare Access Health, Latrobe Community Health, the City of Monash, VACA, and MacKillop Family Services. So as you can see on the slideshow, our catchment areas are for the Outer East, it's the Yarra Ranges, Maroondah and Knox. And for the Inner East, it's Manningham, Whitehorse, Monash and Boroondara. So what is a Family Services Program? Family Services is a voluntary case management and parenting support service, offering support to families in need in an outreach capacity in their home. Family Services aims to promote safety, stability and development using the best interest principles, early intervention and prevention to protect children and young people, improve the family functioning and outcomes for children by enhancing the parenting capacity, creating that sustained change by developing a parent's capacity to meet the diverse emotional and physical needs of their children from birth to 18. It's an ongoing assessment of risk, of needs and the protective factors through the intervention. And we do this through using the best interest practice framework and the MARAM. We look at trauma, we focus on a trauma-informed practice that seeks to understand the depth of trauma and current implications or impacts on children and young people and on their development and well-being. We build and increase the family's engagement with the community. We undertake a collaborative case coordination role, including direct family support. We support families to link into and effectively negotiate the broader sector service system. We develop individual self-determination through holistic strength-based practice, and we ensure connection to culture and family. So how do we do it? So Family Services develop a child and family action plan with families, and this is through selecting goals with regular reviews and assessments conducted with families. Family Services sees families on a weekly basis or as deemed appropriate, reducing contact to fortnightly as families transition to closure. Family Services aims to work with a whole family unit, including separated parents, where it's appropriate. Family Services is a child-centred and family-focused service. Family Services are committed to working in partnership with all services who support families, with regular communication and care teams occurring to ensure better outcomes for those families. Family Services does have access to brokerage and flexible support packages, funds that can be used to help initiate assessments and the introduction into the NDIS, or access targeted counselling and trauma-informed services. Family Services can work with families with a myriad of issues. Here below we have a list of some common issues, but this is not exhaustive. So it may be that parents are having difficulties that's affecting their ability to parent and impacting the child's development and or well-being. Families might be isolated, or they may be unsupportive families. Child and adolescent challenging behaviours might be occurring in the home. There may be significant social or economic disadvantage. There could be family conflict or risk of family breakdown. There may be trauma experience from everyone in the home or anyone in the home. Could be a history of or current trauma. There may be mental health issues or mental illness. Family members might be experiencing or might have a disability. This includes understanding the NDIS. There may be alcohol or drug issues. There might be concerns for the well-being of an unborn child. There also may be risk of entering or re-entering the child protection system. Family Services has access to a senior child protection practitioner, community-based, for consults on risk. They can support and advise family practitioners and help families to manage risks within their own community. The aim of this role is to help families out of the child protection system wherever possible. Practitioners will need to complete a Section 38 consult to safety plan and determine the most appropriate action. Family Services also have access to an Aboriginal Liaison Worker, or ALW as we call them. They are based at VACA, our partner agency, for consults on all Aboriginal and Torres Strait Islander families sitting with mainstream services. The ALW can help with engagement strategies, links to Aboriginal and Torres Strait Islander specific services, and provide a culturally appropriate service to Aboriginal and Torres Strait Islander families. So how to refer to IFS? We're thinking about eligibility. Anyone can refer to the Orange Door on behalf of families. This includes professionals, family members, and can be self-referrals or child protection, just to name a few. But consent is preferable to ensure engagement with families. Family Services can work with families with children aged from 0 to 18 years and who reside in the inner and outer east regions. Referrals to IFS are made via the Orange Door in both inner and outer east. The Orange Door was recently opened in Inner East in 2021 and Outer East this year, and was established to help women, children, and young people experiencing family violence. It's also for families who need support with the wellbeing and development of their children. The Orange Door helps connect people directly to services and provides a coordinated response to a range of different needs. And where required, a whole of family response, including holding perpetrators to account. The Orange Door provides short-term intake and assessment, and if deemed appropriate for family services, the family will be presented at a weekly allocations meeting where all Alliance agencies attend to discuss capacity and the most appropriate allocation to an individual agency. As you can see on this flowchart, this shows the process once a family is referred. So the family services agencies will then contact the family directly within 3 to 5 working days of the allocations meeting to provide contacts and begin engagement and work with the family. In Integrated Family Services, we also offer different specialised programs. For example, the Family Preservation and Reunification Response, the Starting Out program, complex and specialist disability practitioners, or intensive family services, to name a few. Some of these programs are accessed through the Orange Door, while others are through child protection only. Some of the tailored support programs offered to complement family services are the Children with Complex Disability Support Needs program, who provide family preservation, reunification and placement support to families with children with complex disability support needs through flexible case management. Intake to this program can be either through the Orange Door, to child protection, or internal agency referrals, or the Principal Disability Practice Advisor. It's just important to know that all referrals must be endorsed by the PDPA. We've also recently funded the Family Services Specialist disability practitioners whose role it is to build both disability and national disability insurance scheme expertise across the community-based family services systems. They can assist with vulnerable children and parents with a disability to access disability supports and participate effectively in the NDIS. They can also provide secondary consults to family services. Intake to this program is through the Orange Door or through inter and internal agencies. For more information on these programs, please see the navigation guide or call the Orange Door directly. Different agencies can also provide a suite of other services separate to family services, such as early years or family violence, adolescent focused, or culturally and linguistically diverse programs to complement the family services program. Both the Inner and Outer East Alliances are lucky to have two Aboriginal controlled community organisations, VACA and Bundawan, who provide specific support to Aboriginal and Torres Strait Islander families in the inner and outer eastern regions. Family services can be accessed for Aboriginal and Torres Strait Islander families through the Orange Door, or you can call VACA or Bundawan directly for more information regarding their other support programs. So this slide is just we have some frequently asked questions that we've been able to gather. So I'm just going to read each question out and then give you an answer to some of them, to all of them, sorry. Can a professional refer a family without their consent? Yes. However, this is not encouraged as it does not sit with best practice. This can also impact engagement for the family services worker and the family and impact the professional's relationship with the family. So can a professional anonymously refer a family? Yes, again, but this is not encouraged as it does not sit with best practice or help with engagement. How long does it take for a referral to the Orange Door to reach IFS? It can take up to 6 weeks for a thorough intake and assessment process to occur within the Orange Door. But quite often, this is sped up if the family is prioritised as a Tier 1. So what's a Tier 1? The Orange Door developed a priority tool with 3 levels, Tier 1, 2 and 3, to ensure alignment with the Family Violence Multi-Agency Risk Assessment and Management Framework, known as the MARAM, as well as what was the Child First risk factors that inform priority of access. The priority tool is used in conjunction with structured professional judgment to assist in determining the level of risk and priority of a client and can be used to fast-track referrals to the IFS allocations meetings. So next question is, will I be contacted by IFS once a referral has been allocated to an agency? IFS generally need consent from the family to contact professionals. Transparency with the family helps engagement and is considered best practice. However, under the Family Violence Information Sharing Scheme and the Child Information Sharing Scheme, IFS can contact professionals involved if there is a risk concern that needs to be assessed. So the next question is, at what age can an adolescent give consent to work with a support service? This is a tricky question, and so what we have determined is what we consider a mature minor. So that could be anywhere between the age of 14 and 17. This is due to adolescents can get a Medicare card at 15, they can obtain a MyGov account and get a vaccination themselves at the age of 14. So what we strongly encourage you to do is give the Orange Door a call to discuss if you have an adolescent who you think maybe needs some support. So the last question is, when shall I call the Orange Door and when shall I call CP? So we have this slide here just to outline the difference. This is really helpful. So I strongly encourage all of you to have a bit of a read, but really the main difference is that for child protection, it's when concerns have a serious impact on a child's immediate or imminent safety and they're in need of protection. And then there's a list of those things they may need protection from. And in the Orange Door, it's about if you're concerned about the well-being of a child or unborn child and you believe that family are in need of support services to better meet the needs of the children, and that some of those issues are listed, as you can see. So it's just important to note that mandated reports for child protection must be directed to child protection intake. So I wanted to just say thanks for coming to listen to our navigation presentation. I hope you enjoy the rest of your day.